Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 21st of April 2021. So these updates have been running for well over a year now, haven't they? The story today is that we have 2 positive COVID patients, which means their first swab was within 14 days, and in addition another 14 patients who are inpatients because of COVID, but they're more than 14 days. They've been in hospital for quite some time. 8 of those are on the Blackpool Victoria site, 5 are in Clifton, and just 1 patient now in our intensive care unit. So those numbers are still coming down. Of course, we're delighted about that. We're still seeing occasional new cases of COVID where people are very poorly, and of course we have to stay vigilant on that point. I'm sorry to say we have registered 2 more COVID deaths this week, so that takes us to a total of 765 since the pandemic began. The community numbers across the Fylde Coast remain low but not zero. So Blackpool is showing at 15 per 100,000, Fylde the same, 15 per 100,000, and Wyre at 16 per 100,000. And the positivity rates in the over 60s are really very, very low. And we do believe that is a key link to the vaccination programme. So that's a great success for our local population and for the programme generally. And thank you to everybody who has participated in making that such a success. At the hospital, we've delivered over 28,000 doses of vaccine now, and so of course we're doing second doses for a lot of people, carrying on with our programme. And as you'll know, the age groups for vaccination are beginning to come down now, and we're looking at the population of healthy people over the age of 45. So lots of the risk groups have been done, well really they all have been, and now we're working down through the age group. So if you're over 45 and you haven't been immunised, the best way to fix that up is to go on the NHS website, and you will get a link through to book yourself an immunisation in one of the centres across the Fylde Coast. And progressively the age group will come down. And as I'm sure you'll know from the media, when we get to the under 30s, we will almost certainly be using a different vaccine, probably the Moderna one, which is coming on stream now. So that ability to maximise the safety of the vaccine against the populations that we are giving the vaccine to is being carefully thought through. If you do have any concerns about the side effects from the vaccine, then I'd urge you first to look on the NHS website, because there's a lot of really helpful information there. And of course, if you've got further concerns, the way to think about that is to go to NHS 111 or to maybe discuss issues with your pharmacist, and of course your GP practices are all open for advice as well. I mentioned last week that our visiting arrangements are progressively easing as our concerns around the risk-benefit change. I think the best way to advise you if you're going to visit someone on the hospital site is to look at our website, because the arrangements are different depending on where you're going to go, but we're keen to enable as much safe visiting as we can. If you do come on site, of course, we will ask you to wear a surgical mask and to follow the instructions that are clearly laid out across the hospital about how to move around the organisation. What we've noticed is that our emergency department has been incredibly busy over the last few weeks, and that seems to link both with the easing of lockdown and some very nice dry weather that we've had over the last few weeks, which happily seems to continue. The thing is, we've had very long waits in our emergency department, and it's become very busy, and of course we're trying to balance some risk benefit here as well around preventing the possibility of transmission of infection. So I would ask you to remember that our accident and emergency department is exactly that. It's for accidents and emergencies, and if you're poorly but not in that category, I think the best way to get advice is to think about, could your community community pharmacist help you? Could you get good advice from NHS 111? Well, I'm sure you can. And if they felt you needed to be seen in accident and emergency, they can make you an appointment, which therefore would cut out a lot of the waiting times. And of course, if it is a serious emergency, then for goodness sake, dial 999 and the services will deal with that accordingly. We are picking up, of course, our elective surgery programs, very busy in that regard and delighted to be doing that. So if you're waiting for procedures, please bear with us because we're working through that workload as quickly as we can. Testing is still an important thing to remember, so if you think you may have the symptoms of COVID, which are most easily thought of as a flu-like illness, then it is still very easy to get a test, and the best way then is to either dial 119 or to go on the NHS website. So it's a picture of improvement as far as COVID's concerned, a very busy hospital, us trying to manage all of that safely, and then us all thinking about our responsibilities as citizens to look after ourselves and always the others who are around us. So the messages around hands, face and space and perhaps some fresh air remain. Thank you very much.